What self-help tools work best for intrusive OCD thoughts? Have you ever experienced unwanted thoughts that just won't go away? If so, you might be dealing with intrusive thoughts related to obsessive-compulsive disorder. These thoughts can feel overwhelming and distressing, but there are effective self-help tools to manage them. The key is to change your relationship with these thoughts instead of trying to push them away. One helpful technique is noticing and labeling the thoughts as just that, thoughts. For instance, when you think, "I might hurt someone," try saying to yourself, "I am having the thought that I might hurt someone." This method, known as cognitive defusion, helps create distance from the thought, reducing its emotional weight. Another important strategy is acceptance and commitment techniques. This means accepting that intrusive thoughts will occur and not fighting them. Mindfulness practices can help you observe these thoughts without judgment, allowing them to pass naturally. This approach reduces the urge to engage in compulsive behaviors that may temporarily relieving anxiety but ultimately reinforce the cycle of OCD. Exposure and response prevention is another cornerstone of managing OCD. This involves intentionally exposing yourself to the feared thought or situation without resorting to compulsive behaviors. Over time, this can help retrain your brain to tolerate discomfort and uncertainty, weakening the obsessive cycle. Setting time limits can also be beneficial. When an intrusive thought arises, set a timer for 2 to 3 minutes to decide your next step. Instead of reacting immediately, take a moment to think it through. Then, take action even if you do not feel ready. This breaks the cycle of avoidance and builds resilience. Using compassionate self-talk is crucial too. Replace negative self-judgment with kind and understanding language. Remind yourself that having intrusive thoughts is common and does not define who you are. Lastly, while self-help tools are valuable, seeking support from a professional can enhance your progress. Therapies like cognitive behavioral therapy and exposure and response prevention often lead to the best outcomes. Early intervention can lead to significant improvements in your quality of life. In summary, the best self-help tools for intrusive OCD thoughts involve recognizing and distancing yourself from the thoughts, accepting their presence, gradually facing fears, and practicing compassionate self-talk. These strategies align with established psychological treatments and empower you to regain control over your mental health. Always consider consulting a healthcare professional for personalized advice and support.